I'm joined by Priya Madhu. She is an Assistant Director of Nursing from St. Vincent University Hospital. So thank you very much for joining us, and thank you for giving us the time in relation to giving your ideas around patient experience. So I just start off with, what is your understanding of patient experience and how does it differ for patient satisfaction?
Thanks, and thanks for giving me this opportunity. And my understanding of patient experience would be it's a continuum of care that the patient experiences during their stay in the hospital. And basically, it's from the start when the patient enters the hospital to the point where the patient leaves the hospital. And I think it's a much more of an objective approach that we have with patient experience. I think patient satisfaction is much more of a subjective approach, where you can have a patient having a positive outcome and a negative experience, or a negative outcome and a positive experience. I think every journey of the patient, where they meet different specialities, different people in the hospital, it is shaped by the organizational culture, and it's the organizational culture to some extent that gives the perception to the patient about how their experiences are.
So what are the benefits of capturing patient experience information?
I think by capturing the patient experience, you get a better insight of what the patient needs. It highlights, the patient itself highlights what the needs are, and we actually tailor the service to meet the needs of the patient.
So you are obviously an Assistant Director of Nursing.
Yes.
So what added value will this information have for nursing staff in your hospital?
I definitely think it will give recognition to nursing for what they have done good, and it also gives an opportunity, because nursing being the biggest workforce in the health sector, it gives an opportunity for the dedicated nurses across the different hospitals to reflect on their services and also to develop on the services based on the needs of the patient, and also to provide good quality care.
Okay, very good. So do you currently gather this type of information on either patient satisfaction, feedback from patients, or patient experience data itself?
Yes, in Vincent we do have different forums to actually capture this information. We, as Assistant Directors of Nursing or any managers, are very happy to speak to patients on a one-to-one basis. We also get this feedback by email, by form of cards, by phone, and what we do is any positive feedback, we bring it back as a recognition to the staff for their good work and dedication. And also, if there's any concerns or opinions that the patients are raising as part of their feedback, we bring it back to the relevant forums or meetings, and where quality improvement plans can be put in to actually address those issues.
Okay. Can you give me an example of a quality improvement plan that you've implemented in St. Vincent's Hospital?
At the moment, we have something called as a comment card in ED, where actually when a patient comes in, this card is given at the reception basically to comment on the services while they are waiting in ED. So once they go from ED, they can rate the services in ED, and we have a comment box where they can put the card in. Or if the patient has been admitted and is moving up the wards, this card is collected from the wards, and we do a random audit on the cards to see what went well and what didn't go well.
And what type of things have you implemented as a result of that?
It's a new initiative that is put in place. I think mainly it's around communication. It's about the patients would know better understanding of how their needs are met, or maybe more understanding of timely meeting their needs. Let's put it, for example, if you get a busy ED department, they might be they might want to know why they didn't get the services as quickly as they anticipated it to be. So questions around those lines, or maybe around the food or things like that.
Okay. So I suppose, do you think then that the patients that you come in contact with, that you've treated over the years, will see the benefit of collecting this type of information?
I definitely think they will see the benefit, because many patients, this is actually a very good forum where you can confidentially and anonymously voice your opinions back to the health sector, and if that gives you a chance to improve the services, different patients would have different experiences around the hospital, good and bad, and this gives us an honest opportunity to look at those experiences and develop the services according to their needs.
Okay. So thank you very much.
Thank you.
Thank you for your time.
Thank you.